Cardiovascular Risks and Rheumatic Diseases. Dr. Kimberly Liang answers the question of who should be monitoring the risk factors in these patients.
I think that's very debatable. I mean, the last audience response question I had purposely did not have a correct answer to that, but I think generally most people would think that everyone should be on the lookout for the cardiovascular risk factors in these patients, so rheumatologists, primary care physicians, and cardiologists should all be, involved in monitoring and modifying the cardiovascular risk factors.
Dr. Liang said she likes to ask the question in order to raise awareness of the high incidence of cardiovascular disease in these patients.
I guess the objective is really to make sure that everyone is aware of this heightened cardiovascular risk, and especially in rheumatoid arthritis and lupus. And if there's any, primary care physicians out there or cardiologists out there who are listening to this talk, to really emphasize that these diseases really are equivalent of diabetes as far as, the risk of cardiovascular disease. So it should really be approached in the same manner that they approach diabetic patients.
She also said physicians should pay close attention to their female patients with these specific comorbidities.
Right. I think the main thing is to realize and remember that patients with rheumatoid arthritis and lupus are generally young women or middle-aged women, not the typical population that you think of for cardiovascular disease.
And even if RA and lupus patients do not have the traditional risk factors, Dr. Liang said the rheumatic disease itself increases their risk.
So you have to have a heightened, suspicion for cardiovascular disease in these patients, even though you might not typically think that they warrant a full cardiac workup, when they present with chest pain or other symptoms that may be concerning for ischemic heart disease.
For Global Medical News Network, I'm Marquette Smith.